Coronavirus disease, COVID-19, is a global pandemic caused by severe acute respiratory syndrome coronavirus type 2, SARS-CoV-2. This pandemic started in Wuhan, a major city in China, and has spread to more than 180 countries. Coronavirus is affecting people of all ages, but older patients are at more risk of developing a severe type of COVID-19 illness due to their associated comorbidities, conditions like diabetes. According to a study conducted in China showed 133 people out of 344 patients died on the 28th day and 141 patients suffered from comorbidities associated with COVID-19 including hypertension. Similarly, another study demonstrated that out of 633 COVID-19 patients 247 patients developed at least one comorbidity. This study also indicated that 60 years old people were particularly expected to develop the more serious form of COVID-19 disease. Therefore, in this article, we will discuss the impact of comorbidities on COVID-19 patients. Comorbidities' impact on COVID-19 patients. Coronavirus is a relatively novel and understudied illness. The available evidence about coronavirus is also limited. However, based on some case reports, it is safe to assume that comorbidities such as kidney problems, blood pressure, diabetes, liver disease, lung disease, cancer can increase the risk of COVID-19 infection in patients. Similarly, in the elderly population, cardiovascular disease, diabetes, or lung disease are common, which places them at higher risk of acquiring more severe sickness, and an increased risk of dying if they catch an infection like COVID-19. It is also important to mention here, that patients with respiratory illnesses like asthma are at a disadvantage because coronavirus severely affects respiratory tracts, which leads to an increase in asthma attacks, acute respiratory distress, and pneumonia. According to the CDC's weekly report on morbidity and mortality, 34.6% of patients ages of 18 to 49 years had chronic lung illness, like asthma 5. Additionally, HIV-positive patients with lower CD4 count and people not receiving antiretroviral treatment are at more risk of developing additional medical problems, including COVID-19. Similarly, according to the International AIDS Society, HIV-positive people, individuals on antiretroviral therapy, and patients with higher CD4 count are at higher risk of contracting COVID-19 infection as those who are HIV negative. Furthermore, data from the research shows that 15.8% COVID-19 patients had hypertension, 9.4% of patients had diabetes, 1.4% of individuals had COPD. Commodities reported in COVID-19 patients and death percentage. This data is taken from hospitals and nursing facilities from New York, as of April 6, 2020. This data shows that 55.4% of patients with hypertension died due to COVID-19 infection. Moreover, 8.3 individuals suffering from COPD died because of COVID-19. Therefore, it can be concluded that patients with comorbidities can acquire more severe form COVID-19 infection, which leads to their death.